Good evening, I'm Claudine Ewing. Welcome to Friday Night Fight, Knockout COVID, brought to you by Buffalo Toronto Public Media in collaboration with the Community Health Center of Buffalo. As we approach the 2-year mark of the COVID pandemic, lives have been forever changed. Misinformation has spread as quickly as the virus. Trust in our institutions has eroded, and vaccine-hesitant citizens continue to be stricken. Fighting COVID in our communities of color has been especially challenging due to healthcare inequities and shortfalls in community education. We begin tonight with a locally produced documentary that explores these concerns. Immediately following, medical experts and community members will join me to continue the conversation with you, our viewers. Reach out now to have your questions answered during our upcoming live discussion. But first, this is Fight for Good, one body, one soul.
When COVID hit, and it hit Niagara Falls disproportionately, I would think, than most of our even communities, underserved communities, or communities of color. Tell us about some of the experiences that you all have had.
Well, actually, we saw it on television, and I can speak for a lot of people. That's across seas. That's never going to hit us until people that we knew start dying. And we're like, okay, wait a minute. This thing is for real. Really real. Especially when it came and knocked on our door. My family have lost a total of 6 people to coronavirus, including my sister, who was the first Black hairdresser that owned the salon in Niagara Falls. She passed of coronavirus. My sister, Christmas morning, she had a heart attack due to COVID. And then New Year's Eve, we had to take her off life support.
Niagara Falls is unique because most people don't know there is a Niagara Falls, New York, a Niagara Falls, USA. And we are literally 8 minutes from Niagara Falls State Park, which is the oldest park in America. We sit here as the last stop in the Underground Railroad, and yet people don't even know that there's an African American group of people here, and they're living in poverty. So when we built this health center here, because we were blessed to be able to build it from scratch in 2015, we knew that this was the place to be. The housing authority is right across the street. But the poverty of being one of the 7 wonders of the world is just amazing. That we have the Niagara Falls that people from all over the earth come to see, and 2 miles up the street, we're living in poverty.
When you think about the journey, and I'm talking particularly to African Americans, their journey from the South to the North was primarily work in the manufacturing industry. So that's what brought us here. And however, as you know, industry left, and it left many of us devastated because we didn't have, we only had skills to work in factories. We did not have the skills that the new society called for. So we had to do some type of retraining because we, for whatever reason, was not prepared for the new type of economy, the service economy, retail and tourism and things like that.
This particular location of the health center have been so impactful for so many different areas around here, because there's projects surrounding this community health center. There has never been anything like it.
So actually bringing a health center and building it from scratch in this community was something that gave people hope that we kept our promise. So hesitancy doesn't just come from the history of vaccinations or healthcare, but it comes from a society that promises and don't deliver. So our hesitancy is really education, but also keeping our promise.
So I think the hesitancy has a lot to do with information, proper information, distorted information. I think if you're going to give people accurate information, I think they will be more willing to, to get the fact. So getting vaccinated is really nothing new for us, and it is unfortunate that we have taken these false conspiracy theories about vaccinations and ran with them and doing our families harm, because we are dealing with different type of comorbidities that other communities are not dealing with. And one thing that I realize about getting vaccinated is that, yeah, there's a possibility that you may, if you let your guards down, you may get, COVID-19, but at least you won't die from it and you won't be hospitalized.
We have Facebook, we have all these different ways of people getting communication, but it's super hard for us to do correction when you get bad information from the beginning.
So today we have the Johnson & Johnson COVID vaccine. So I'm just going to show you how we prepare the dose. So we have our vial here. In the vial we have 5 doses. So to prepare the dose, we take an alcohol swab the cap here. We swirl this around a bit. We don't shake it, just gently swirl. We have our syringe here. The dose for the Johnson & Johnson is 0.5 mLs. So I'm just preparing that. Taking the cap off. And then we're going to tap out any air bubbles. Put the cap back on. So now the dose is good for storage. So this dose is good for 6 hours in the fridge. So we're going to put our syringe in our baggie here. And then we're going to take this to the fridge for storage. When it's ready for use, we can pull it out.
So if we level set, what does a vaccine do? A vaccine either prevents disease or decreases the severity of disease. So those are 2 points of vaccines. This particular vaccine, some of them prevent disease and some of them decrease severity of disease. But what we do is this is not a live vaccine, because one of the other mistrusts that people have is that we're gonna give you COVID. This vaccine cannot give you COVID. It doesn't have the DNA structure to even do that. What it does, however, is it gives you what we call the antigens, which are around the spike proteins, we call it, on the virus. We give you that, and then your body recognizes and says, that's foreign to me. And so it creates antibodies, and antibodies are what we need so that we can remember what something looks like. That's what we do. So we basically give you the antigen, or what allows us to become infected, and our body makes antibodies and it revs our systems up so that way, God willing, if we ever do see it again, we'll have the antibodies to fight it off.
From where I sit, I realize one thing, that I must continue to educate people with the information that I get from the people that's doing the research. It's important because a lot of times within this community, we're not listening. We're undereducated, and we're going off what other people say. We're listening to the news and we only get one thing off the news, and that's it, and we run with it. And we take that information and we tell everybody in the community, and everybody's thoughts are stuck with that.
How we communicate is not working. It's not what you say, it's how you say it and when you say it. And in healthcare, we're just not doing that. We have all these HIPAA laws and HIPAA rules, and people want to say the right thing. And once again, I don't know if that's this generation, if it's this time. People want to know you. They want to know where your vulnerabilities are. They want to know you.
We are active in the community of making sure that we try to educate as much as we possibly can, and we get ambassadors. So we've been having Zoom meetings with the barbers and the beauticians, because we're educating. They're telling us the stories, right? They're telling us what we're hearing, because we don't necessarily know, because they see in the community every day. So we said, teach us what you're hearing, and then we can make sure that you get the information. Because you have to remember, as African Americans, we don't necessarily have access to a lot of physicians or people of color that you trust or have that passion for the community. So we actually make ourselves accessible and available.
Here is your get out of jail free card. All right, thank you for doing what you can to prevent the spread, and you are all set.
The role of black men in educating the community. We chose the barbershop because it's very real, it's very grassroots, and it's our community. So tell us some of what do you think, how can we educate the community, particularly with COVID-19?
You know, for me personally, I knew the virus was real, and I knew how, deadly it was. But from a personal standpoint, to see, your close friends, to see, family members die from it, I think that was the biggest change for me. To talk to, your loved ones, and y'all going over, their last request. That's a hard pill to swallow. You know what I mean? And I don't know, how many people can really fathom that until they go through it. That's not something that you want to, have to deal with. So if a vaccination can prevent that stress, I think is well worth it.
We have to be present. Healthcare has to be present. The whole have them come to the brick and mortar is not the way it works anymore. This is not this generation. This is not this time. The notion of build a beautiful facility and people will just come flooding through the doors because you got nice tile and pretty paint on the walls, it's not that generation anymore. So when I think about what healthcare plays, we just have to be present. We have to be present to meet the needs before they need us. Before they need us. Because if we're just present when they need us, we're too late.
Yeah, I have a question pertaining to the COVID. I think it's a very serious question. It's brought to my attention that 46% of African Americans died due to this COVID. I'm wondering, why is the number so high with African Americans vice other nationalities?
Yeah, I think one of the hard things is that we're always the ones dying, right?
Correct.
And I think part of it, I always tell people that COVID is a health disparity on top of the health inequity. And what that means is African Americans, we tend to hold more forward-facing jobs, right? So there's a lot of social dynamics. But the one thing that I gotta make clear, there's nothing different about your DNA and my DNA that made us more susceptible to COVID and the reason why we're dying, right? It's mostly the infrastructure and what we call the social determinants of health, right? Meaning that your race determines your health, right? Some of the social structures determine your health, right? So if you don't have a job that you can take time off for, right? You going in, right? And a lot of us have forward-facing jobs, healthcare jobs. Some of us were in transit, a lot of public-facing jobs, which increased our risk for exposure. The other part is mistrust of the system, right? You catch COVID, half of us ain't going to the hospital, right? Because of that mistrust. So there's all these different social structures and dynamics that cause that over 45% of deaths in our particular community. But I think the important part is that there's nothing different about us and everything about the different dynamics that makes us more vulnerable for any disease, whether it's COVID or whether it's something else.
Like just talking to her for 5 minutes got me a lot of answers that I haven't gotten in a year.
Exactly.
So I think it's definitely good that we got people like y'all here that's touching the people on the street and talking to them one-on-one.
I mean, at the end of the day, we don't have the range of our colleagues, at least as a black CEO and one of the only ones in healthcare right now, me. I don't have the range of my counterparts to just relax in my community. I don't have that range. They can go home.
And then, like for my situation, I was 100% against getting the vaccination, and then 100%. I was like, they're not going to use me as a test dummy. But then what happened was, I got COVID, and I'm a heavy guy. So my cardio was real bad. I was having problems breathing. My wife was like, I'm taking you to the hospital. I was like, you're not taking me to the hospital because I've seen a lot of my friends didn't make it out. They died from it. So I said, I'd rather die at home than die in the hospital from COVID. So, thankfully, my symptoms got better. And then I got a call about 2 weeks later from the VA. I'm a disabled veteran. So they said, we're giving the vaccinations out free. You're a veteran, come on in. A hard ass there. I was like, I'm getting the vaccination. Considering I was 100% against it, then when I actually got hit with the COVID, I was like, I'm getting this vaccination. I was about the second one in line. Pop.
I think it makes me more comfortable seeing people like ourselves.
Yeah.
For me, that's what it was. Seeing more people of my skin tone going and getting the vaccination. Because that was a big fear. We were seeing everybody else go that weren't of our race. And we had so many misjudgments listening to everybody speak about what happened in the past, Tuskegee and stuff like that. So, that scared a lot of people like us from the vaccination. And like I said, I think seeing more people of our color made me want to get the vaccination. So that's why I got it.
And that's important. I think representation, diversity is important, right? I think sometimes they gloss over it, but sometimes just walking in a room and seeing somebody else looks like you and you ain't got to do the count thing where you're like, right. There's 1, 2, 3, you know what I mean? There's 3 of us, right? Mm-hmm. So I think it does help. That's why representation is super important, especially for young black men, right? I think that I've always said, I think you guys are the forgotten group. I mean, black women, we have OBGYNs, we're used to going to other, but my young black men, you guys don't emerge until something's wrong, and that's too late by then. But I'm glad you got vaccinated. Was it bad?
I'm glad to know.
It wasn't bad, right? All right, you made it through. You're alive?
I'm here.
You're alive?
I'm here.
So that's good. That's good.
I decided to, get out of my office and walk the community. And I saw an elderly person sitting on the porch. I knew him as the reverend that lives in this area. And I sat on his porch. He went and got a chair. And he said, Reverend, I wish more leaders in the community would get out and just walk the neighborhood and talk to the neighbors and find out what's going on and what we need. So I think we need more of that. Get to know your neighbor, get to know who lives in the community. And I think that's needed.
You're one of our main supporters of the health center.
Yes. Yes.
As a healthcare provider, what could we have done differently or better to make sure that we could have helped in some kind of way?
I want to say you do a lot already. Your presence, just your presence in the community makes us safer. By the way, I grew up, born and raised on Center Avenue. And where your building is, that was my school. And I remember when my sister got COVID and we didn't know that she had it, we suspected she had it. And we sent all our neighbors, we told our neighbors, you're right across the street. Go across the street and see if you got the virus, because they didn't even know, and they all had it.
We continue to show up for them. We continue to stay educating them. We continue to provide them with the information. Because information without application is just information. And I want to be able to continue to provide them with the education that's connected to it, because they need to know.
Do you know if people have gotten COVID?
I know a lot of people that got COVID, yeah, definitely. I've caught COVID also, and it wasn't nothing to play with. Was it early on? It was actually that March when it first came, like that first Saturday we shut down. I caught it that Saturday night where I was knocked down for about 2 weeks. A couple of my fellow barbers, they were also, knocked down. Shaw, he raising his hand over there, he got it also. It was a tough process getting back right, and I heard what you were saying, like far as your smell and your sense of taste and everything. It definitely takes a while for that to come back.
If you could share a message to the community, what would that be?
We got to stay safe. We got to keep the community safe. Go take your vaccination. It's not a game. We got to get right. That's it.
Thank you so much.
Yeah.
Thank you, Kenny.
Yeah. All right.
Our communities have trauma before COVID. We didn't deal with it well then, but one of the things that COVID has done is exposed it. I can tell you from talking and working with my dentists, we're seeing the results of COVID people's anxiety because they grind their teeth, right? Nobody talks about that, right? They're grinding the teeth. The domestic violence that we're seeing, we can tell it from your mouth, because your mouth, you come in and you're saying, can you fix my tooth? But we can see from the way the tooth is hanging that you've been punched.
Mental health. Mental health. This pandemic has played on us in ways that we didn't think. Back in February, we was having a food giveaway, and I saw an elderly gentleman, and I asked him, I said, how you doing? And he said, lonely. And I asked myself, how many other people are feeling the same way? You disconnected from what we know as community. Yes, Facebook is nice, Zoom is nice, and all the different things we're doing are nice, but it does not replace community.
What are some of the lessons you think we can learn as a community?
We have to learn to believe things. We have to learn to act and move fast on things. Had my sister been vaccinated quicker, or even just knew about it, that this thing could take you out, she would have had a vaccination. We were fearful because we didn't know. Everyone said, what is in it? What is in it? Why are they putting the virus in us? This is what they're saying. So we need more knowledge. How about that?
What I would like to say is that how important it is to get the information that is needed for everyone to be vaccinated in regards to this COVID situation that we're going through right now. This is like life and death. and all the things that's going on right now in this community, in this world right now, if it's just a vaccination that we gotta get to help us keep moving forward, then let's get the vaccination. Let's get educated enough to get the vaccination.
You have nothing to lose. The only thing that you lose if you don't get the vaccine is catching COVID and not living to see this pandemic through. It's very real. At the end of the day, the benefits outweigh the risk. And this is not your old healthcare system. Even though I know that the mistrust and the hesitancy is there, the system has us in mind, and it would not put a vaccine out that was not safe. That system is not there anymore.
The first lesson that I think we learn is that all of our human lives depend on each other. There's 7 billion people in this world. We can't think that what India is going through right now, of 4,000 deaths a day, doesn't impact us. We're not going to get this disease under control in a year. We're already close to a year, if not a little more than a year, because we can't vaccinate 7 billion people in 1 year. So logically, we got a lot of time, more time, to get everyone vaccinated. So the lesson learned, I think the major lesson learned, that all of humanity depends on each other for all of us to survive.
This virus would come and tear our lives apart. I never would have thought your name, Vanessa, would be among the millions that sadly departed. If only I knew it would be the last time I would have saw you. Rona May blues, Rona May blues, Rona May blues, got me singing Rona May blues, Rona May blues, Rona May blues.
That was Fight for Good, One Body, One Soul. I'm Claudine Ewing, and you're watching Friday Night Fight, Knockout COVID. It's time for you to get involved in the program and help us continue the conversation about COVID and vaccines. Call us toll-free from either side of the border. The number to call, 888-858-9236. We're also streaming on Facebook and YouTube, where you can ask questions right in the chat, and we're looking forward to hearing from you. Over with our phone volunteers right now tonight is Francesca Messiah. Francesca, good evening to you.
Good evening, Claudine. This program is awesome. And don't forget to call us on either side of the border at 888-858-9236. When you call in, you will receive an informational package about from the CDC on COVID-19, which will include the top 10 reasons to get vaccinated against COVID. Also, you will included in this package is information from the Community Health Center of Buffalo, where they're located, the dates and times where you can get the vaccine, You'll also receive information about COVID and a wonderful website. Feel free to send in your questions via the Buffalo Toronto Public Media Facebook page live, and please go to our YouTube. We're also on YouTube where we are streaming live. Thank you, and we'll be back with you shortly.
Francesca, thank you. We will check back in with you throughout the evening tonight, but we want to let you know in studio right now are 3 Western New Yorkers featured in that documentary that you just saw. Dr. Levon Ansari and Dr. Kenyani Davis, both from Community Health Center of Buffalo, and Kenny Harris from Signature Cuts Barbershop. We want to thank you all for being here, and let's jump right into the conversation. I guess the first thing we have to ask is, because this is something people are always saying, is the vaccine safe?
Yeah. First, thank you for having us. Super happy to be here. The vaccine is safe. It's went through the FDA process, which is a four process phase clinical trial. And we are in this pseudo clinical trial, I like to call it, but it did pass a rigorous testing process from the FDA. So the safety is safe enough for them to go out into the general population.
That's interesting to know, and people need to know that, right?
Absolutely.
Because that's one of the things they keep saying. Is it safe? It's not safe. Why would I take this?
Absolutely, and I think that's the reason why I'm very, I take it upon myself to really educate people on what a clinical trial is, because we've never in our lifetime been able to see something like this actually happen. I see it in my work all the time when new medications come to fruition, but the majority of the population don't see it. And I got to tell you, it lets us know that our process is working. We were able to identify adverse reactions that happen 1 in a million. That's actually pretty amazing.
Good information to know. Dr. Ansari, let's turn over to you. We have seen the lack of quality information out there, misinformation. I mean, misinformation is just rampant out there. How does this wrong information spread? And how do these conspiracy theories, because that's what they are, how does it really hurt our families?
Well, years ago we didn't have social media. So today you have a bombardment of misinformation or even good information, but it's 24 hours a day. So it's very difficult for us, particularly in healthcare, to keep up with misinformation that's coming at people 24 hours a day with rapid pace and multiple venues. You know, when I came up, we just had TV and it was black and white.
Yeah, more than that now.
Right. Now you have multiple platforms that people are getting information. They get them on their phone in real time. So while they might be getting some good information, they're also getting bombarded with a lot of misinformation. So we really have to really come up with a really concrete plan to actually get the good information out in real time, so that people can actually absorb it and be able to do it repetitive. If you realize misinformation is repetitive.
You're right.
And we haven't caught up with that yet.
We are already getting questions in, and this is from Joe in Lockport. Which vaccine is better, 2-shot or 1-shot?
I always say the one that you actually get is better. They don't really have them too much head-to-head, but the Pfizer and the Moderna, which is a 2-dose vaccine, is a messenger RNA vaccine that looks similar. Johnson & Johnson is the 1-shot vaccine. I always tell people it's a personal preference. All 3 of them decrease hospitalizations and death and decrease the severity of the disease. So you're better with any one of them versus nothing.
Kenny, let's go to you, because I don't want to forget about you, because you're boots on the ground, you're in the barbershop, you hear from those who are on high, those who are on low, no matter where they are in society. They're coming to Signature Cuts, right?
Yes.
You've heard some misinformation.
Oh, there's a lot of misinformation out there. And now, it's been a couple years with this virus, rolling. So they're more aware now of the consequences of this virus. And right now, at first, people, they were against getting vaccinated. And now a lot of people, they want to get vaccinated, and a lot of people lost a lot of, family members, and it's not good, but now this, like, as far as within the city, people are getting more knowledgeable of what the vaccine can do for you. And they're not pushing it away and coming up with all these conspiracy theories, like, like you said.
Did you find that in the barbershop, people in the beginning were like, no, no, no,
Oh, yes.
and now it's completely
No,
changed?
definitely. At first it was, no, no, no. What are you putting? What are you injecting in me? What are you doing? You know, are you putting a chip in me? And what, you know, that's what, you know, little things people say. But now a lot of people, they're getting their vaccines. The younger generation, you know, we paired up with the community health center, and we actually did a vaccine drive. Come, you know, get a free haircut and you get vaccinated. You know, and that actually was very successful. You know.
That's working. That's
Yeah.
great to hear.
Yeah.
We want to let you know that funding for Friday Night Fight Knockout COVID is provided by Community Healthcare Association for New York State. Let's check back in with Francesca Messiah.
This program is fascinating. Thank you for all who have taken the time to call in your questions. What we need for you also to call, but when you call, you want to call 1-888-858 932. I'm sorry, 1-888-858-9236. We need you to call this number. We need you to get the information. As Dr. Ansari said, this information is going very fast. We need you to call to get the information so you can share the information with your friends about how the COVID vaccine is given, and it includes a breakdown by what age, what are the safeguards by age, and how the vaccine was developed. Feel free to send in your questions via Facebook Live. Facebook Live is WNED at PBS. Also, you can find us on YouTube, and on YouTube, we're on Buffalo Toronto Public Media. Thank you. See you in a few.
All right, thank you, Francesca. We're going to now continue our discussion with our panelists. Dr. Davis, after seeing that documentary, there were so many statements that were made by each of you, but you said something that was interesting. You said COVID is a health disparity on top of a health inequity. Underserved communities, communities of color, we have a large immigrant population. They were already experiencing trauma before COVID came along. So what challenges do these communities actually face now?
Part of it is, one, keeping up with the information, right? And now that the boosters came out, part of it was you get people who are all gung-ho about it. And then, like Dr. Ansari said, that misinformation starts to go through, and then the mistrust starts to bubble up again. And then the same population that was more vulnerable from the start are now even more vulnerable now without boosters, because now you have different variants that are coming. People are getting sicker quicker. We can't even get to them in time. And so this is a population that was already underserved, already didn't have access, already was not connected to care, who now are unfortunately have misinformation, and now they're also dying at an accelerated rate as well.
Yeah, Dr. Ansari, in the documentary, you stated something too. You said hesitancy comes from a society that promises but doesn't deliver. Why is there a history of mistrust over vaccinations?
Well, you know, historically, we, you know, as people of color, and particularly African Americans, our experience with medicine has not always been favorable. But one of the things, the way I explain it to people, is that the history we know is not coming back. The future we can't see, but we're dying disproportionately today. We've been blessed with the best scientists in the world. We are blessed with more access to information, even though it might not be maybe misinformation, but we have to live today. So we have a vaccine, we've been blessed with a vaccine, and we need to use it because it's available to us.
Before we go to another viewer question, I want to ask you, Kenny, something. I know your clientele includes Buffalo Bills.
Yes.
So obviously this conversation has come up with them as well.
Yes.
And then just people in the neighborhood. How has COVID affected all of your clientele?
Well, you know, at first, we lost a lot of clientele. You know, people were scared to come in the barbershop and just being around people, you know, and so we know we had to counter that, and basically everything is sanitized. Everything is clean. We're using disposable capes, sprays, you know, barbicides, you know. So at first it was a significant change, you know, within, you know, just within the volume, I would say. But, you know, everything has picked back up.
Here's another question from one of our viewers. Danny in Buffalo wants to know, what is the biggest barrier for people to get the vaccine? Is it availability or misinformation?
I would say misinformation.
Misinformation.
Yeah.
Misinformation.
I mean,
yeah.
I think initially it started with not having enough vaccines, right? We started there. Then we got enough vaccines, the misinformation has spread. Now you have to coach people to get the vaccine that's now available that wasn't initially.
Right. That they don't want to get now.
Right.
Right.
That they don't want to get now. And that's interesting. Yvonne in Buffalo wanted to know, what is the vaccine made of? And I think this is important, that the fact that we are this far along and people are still asking these questions because people are still not vaccinated. Not everybody is vaccinated and people are still dying. What is it made of?
I get this question a lot in my practice for people who don't want to get the vaccine, because then I tell them and they're like, oh, no, I'm allergic to that. It's listed on the CDC website. I will say that there is a not a black box warning, but there is a warning that people who are allergic to PEG, some of the messenger RNA vaccines, may not be the best choice, for you. But the other question I get a lot is mercury. Is there a lot of mercury in there? Well, we have really good regulatory systems that will not allow you to put lethal levels of particular metals such as mercury inside a vaccine, so that's not there either. But it's listed in the CDC, and it's actually not as many ingredients as people think it is.
This is so informative, because the fact that we're answering questions that people want answered, and these questions are still coming up, it's good. We're going to continue our conversation with you all, but now we're going to get ready to go out to DC. We've been discussing how the COVID pandemic has affected underserved communities here in Western New York, but now let's broaden the topic and examine this issue from the federal perspective. Joining us via Zoom from Washington, D.C., we have Shakita Brooks-LaShore, Administrator for the Centers for Medicare and Medicaid Services. We want to welcome you to our program here in Buffalo, New York.
Thank you so much for having me. And more important, thank you so much for hosting this topic. It's so critical for all of the country, but particularly for communities of color and our community.
And with that being said, when you got this position, what challenges did you face right away after being confirmed to really what is the second highest post in HHS during a global pandemic?
It certainly has been, for all of us, a challenge dealing with the COVID-19 pandemic, and your panel and the documentary really outlined a lot of the issues. I would say I try so hard to see this as an opportunity. And I would say that we at CMS are working as hard as we can with partners to help educate people about COVID-19 vaccines, treatments, the boosters. Don't forget the boosters. Get boosted if you're vaccinated. But also just an opportunity to highlight how important health insurance coverage is. That's really the role of CMS, to get people covered. And make sure that coverage is meaningful. And as it really came out in the documentary, it's not about just getting vaccines. It's about treating your underlying conditions. It's about all of those things. And I think we are at a moment where people are understanding health disparities in a different way. And so I see it as an opportunity to use our programs to really try to make sure people get coverage.
How did Medicare, Medicaid, the Children's Health Insurance Program, and the Affordable Care Act, which we often hear about, serve us during the pandemic, and what can be done better?
So I would say when you look at our programs, which is you mentioned them all, that's 150 million people who get coverage through those programs. Your health insurance card is where you get your treatment. So as people were needing to go to the doctor or going to hospital, all of those services. And so the things that we have done, among others, are making sure that all of the vaccines are free, no cost, so people can go and get those treatments. Right now, one of the big things is making sure that you can get over-the-counter tests to know if you've been exposed to COVID-19, so you're not disseminating it. And that's a big piece right now of making sure that we contain the COVID-19 pandemic, but really want to emphasize just how important it is to have coverage, to go to the doctor, to get those underlying conditions treated as well, That's one of the big things that for our community, I think is so important to remember, that getting treatment for all of your care is critically important.
Shakita, we know that politics often rears its ugly head in so many instances, but despite that, are there any innovative healthcare alternatives that need support that will get across both sides of the aisle?
We have such tremendous opportunity right now. There's so much that we're doing in terms of trying to make sure that people have access to affordable coverage. The American Rescue Plan, which was passed under the Biden-Harris administration, has made coverage so much more affordable. So we saw record enrollment in terms of marketplace coverage, the ACA coverage this year. So many people have found coverage for less than $10 for free. We've seen across the country just so many more people enrolling in Medicaid and CHIP. And so there are many things to continue to build on in terms of things that we'd like to see as we really advance health equity. And I would just add one of the biggest issues among our population, so many, but one in particular that is near and dear to my heart, as well as the vice president on down, is maternal health. And there is such a focus in the administration right now and through Congress of trying to make, to address the health disparities in maternal health, which are quite severe. It's just we see such disparities, not just among income, but Black women of all income and education really are seeing disparities compared to their white counterparts. And so that's a particular area of focus for CMS and for the states as we try to really address maternal death and mortality.
Shakita, thank you so much for joining us this evening on a Friday night from DC. We're in Buffalo where it's snowing and cold, but we thank you for taking time out to be with us, and we hope to tap into you at another time. So thank you for your time this evening. We appreciate it. And we also want everyone to know that funding for tonight's program comes from Community Health Services of New York State. We're going to toss it now over to Francesca in the phone bank.
I hope you're enjoying the program. And again, we encourage you to call in at 1-888-858-9236. I will say it again. Please call in and ask your questions about the vaccine, about everything you've heard this evening at 1-888-858-9236. And also when you call in, that's a lot of information that's been shared this evening. But when you call in, you'll receive that information. You can make copies of that information to share with your friends and family. And I can't stress enough about the booster. Please, you want to make sure that you receive your booster. There's information in the packet that will be out talking about the booster and steps you can take to protect your family and our community. Again, don't forget to send in your questions via Facebook Live, and that's Facebook at WNED PBS, and also you can watch us on YouTube at Buffalo Toronto Public Media. And I must say one more time to call in for your questions and to call in and most importantly receive that information at 1-888-858-9236. Claudine.
Francesca, thank you very much. We're going to go back to our panelists. COVID fatigue, it's real, right? The current trend with COVID, it looks positive. We saw this before, then you hear about another variant. So that's always a concern with people. Our medical establishment developed an effective vaccine, obviously, in record time. But the virus is still exploiting flaws in our human nature. So what have been the biggest strengths and weaknesses in this fight?
The thing that's so good about us Americans, right, is we tend to be scrappy and we want to do things our way, and I think that's kind of what has contributed to this great country. But that same thing is what's the weakness right now. I think we all know that we want to help our fellow neighbors out, right? But then there's that individuality that I think everybody still wants as well. But the truth is that we have to help each other out. You know, I'm accountable for your life. You're accountable for my life. And I think one of the biggest weaknesses that we have right now is I think people forgot about that. It's more individual now versus what can I do for my fellow man. One of the biggest strengths is that, truth be told, is we got a vaccine out pretty quickly. It seems quick, but people have been working on this technology for 7-10 years. We just needed something to put it with. So it wasn't as quick as people may have thought it was, but we got it out to a mass amount of people. There's other countries who haven't even done that. And we have it, and we still won't take it.
Yeah, I think it's so great that we are just having this conversation. I have to bring up masks, right? And somebody called in with that question. If a person chose to continue to wear a mask outside or at all, is that okay?
Listen, they'll be right with Dr. Ansari with their mask, so it's okay because Dr. Ansari is not taking her mask off. It is absolutely okay. I still wear my mask. I was at the store today and I still wear my mask. Truth is, not only has the mask decreased the spread of COVID, it's also decreased the spread of other viruses and colds that are out here that predominate during the winter months, so it's not a bad thing.
Kenny, I just have to go back to you because you talked about attitudes changing with people.
Right.
Let me just say for myself, I was not going to be the first one out the box to get the vaccine. I was not. When it hit somebody in my family really hard, I was like, when can I get this?
Right.
And how fast can I get it?
I was the same way. And like I said, I caught it on the first wave, and it knocked me out. I was in the basement for about 2-3 weeks. You know, I had to stay away from my family, and that was tough. So,
yeah,
you know,
it's real. People are hearing this from people who are experiencing this all the time. You're the barber. I'm just the girl doing the news, but I'm telling you, when it hit home, because when you start seeing people dying, it brings a whole different perspective to you. Dr. Ansari, looking at the group of Americans who are willing to not get vaccinated, and they think COVID's really not a big deal. That mindset is still out there. What factors contribute to that? What do we need to do to change that? We're having this conversation. If we can change, or if you can change some minds right now, what do you say?
We want to be able to be accountable. I want to go back to what Dr. Davis said. We need to understand that we don't live in a world by ourselves. And COVID, this is something that nature brought on, right? Regardless of some of the other myths you might have heard, we don't control nature. So we're sitting here wanting to say, you know, this is over. We don't want to take the mask off. But nature does what it does. So what we need to bear in mind that we are human beings and that we want to make sure that we all live and respect one another. Yeah. And that's one of the things that this disease had made us do is self-reflect as human beings.
You're right. Dr. Davis, you've probably heard, we've all heard people say it's probably nothing but a bad flu. I remember when a prominent developer, Mark Hamister, passed away, and I talked to his kids, and they said if we only could have had that one more conversation, just that deep conversation with our dad to get vaccinated. Explain to people how serious this is. What do they experience when you get COVID? Kenny, you know, you're in the basement. And it's not fun being in the basement.
At all.
But what is it doing to the body?
Yeah, you know, it's funny. It is not the flu. I had COVID in November, so a little bit after you got it in March. Right. And it is not, I've had the flu. And I'm telling you, it is not the flu.
It takes about a month to recover.
Right.
You got to recover from being beat down. Like, you have to recover from that. And that's another process. You know,
right. That people don't talk about.
Right.
It's trying to recover after. I thought I was going to just jump back into my super mom life. Right. Absolutely not. It took about a month and a half. I mean, you would walk, you'd get winded, the mental fog, the taste going in and out. I lost 10 pounds, so that part was good. But I mean,
but you don't want to lose it that way.
Yeah, I didn't want to lose it. It came right back.
Right.
But the thing is that the chills, it felt like somebody was stabbing you. Like the headache, you felt like you were in a vice. I've had the flu. It was not the flu at all.
It's like it came alive at night.
At night, yes.
It comes alive.
The pressure on your chest. And there was a moment, and Dr. Ansari can tell you, she called me, and I could not talk. And I just remember saying, God, just make this stop. And then I had to realize, like, no, that means I would stop breathing and then I would die. So don't do that.
Yeah.
But I needed to pass.
And these are the things that we want our viewers to really listen to. You're hearing it from the doctor, you're hearing it from the barber. Funding for Friday Night Fight, Knockout COVID, provided by Community Healthcare Association of New York State. We're going to check in right now again with Francesca.
And I'm here today with a special guest, Marcia McWilson. Good evening, Marcia.
Good evening, Francesca.
And we're going to speak with Marcia about her family and her family's experience with COVID.
Oh, Francesca, my experience was absolutely terrible. Never in a million years would I would have imagined I lost 6 family members, including my sister, Vanessa.
I'm so sorry.
Oh my gosh.
I'm so sorry.
Who would have ever thought?
So Marcia, what's your, what can you share with the community, especially those who are still hesitant about the vaccine? What would you tell them?
I would tell them, you wouldn't want to trade places with me. The thing is, it is safe, it has already been proven, and we always wonder, what's in it, what's in it? Right. But we don't ask what's in anything else.
Right.
Take the vaccine and don't be like me. Just every day I think of my sister and I say, who would have thought this virus would come and tear our lives apart? I never would have thought, never in a million years, your name, Vanessa, would be among the millions that sadly departed. If only I knew it would be the last time I would have saw you. Rona May blues got me singing Rona May blues. Rona May blues. You don't want to sing that song, Francesca?
No.
Trust me.
Thank you. Thank you so much.
Thank you
for sharing.
Francesca, thank you so much. And just briefly, before we get ready to go to our live stream and end this program, when you hear that, is it real?
Yes.
It's real?
Yes.
Is it real, Kenny?
Yes, it is.
Dr. Ansari?
I can tell you, I can't even count the times. I'm tearing up because I can't even count the times that I hear horror when people call and say, I can't breathe. Because I get those calls.
Yeah.
And or their family member is saying, they can't breathe. They can't breathe. They can't breathe.
Yeah.
And I'm just telling you, it's not. It's a horrible sound.
We thank you all so much for being here with us. We want to now say goodbye to our audience watching on WNED PBS, but we're going to continue this live streaming of this discussion. The program is going to be online, so we want to keep taking your questions. Keep sending them, keep calling. You can join us now on WNED PBS Facebook page or the Buffalo Toronto Public Media YouTube page, where we will keep the conversation going. Again, thank you so much for being with us. Again, COVID vaccine clinics are going to be coming up. There is one tomorrow, Saturday, February 19th, at the Community Health Center of Buffalo. That is located at 34 Benwood Avenue. That's in the city of Buffalo, not far from Bennett High School, 9 a.m. to 4 p.m. for ages 5 and up. We didn't get a chance to talk about pediatric vaccine. We can maybe do that online. Again, the COVID vaccine clinic is tomorrow, February 19th, and also at the Community Health Center of Niagara Falls. That's located at 2715 Highland Avenue in Niagara Falls from 9 a.m. until 3:45 p.m. Again, the ages 5 and up. The doctors here, everyone on this panel is asking that you come out if you have not gotten your vaccine. And to schedule an appointment, you can call this number, 716-986-9199. Press the number 9. Walk-ins are welcome, and that is so important. Again, thank you for joining us for this evening for Friday Night Knockout COVID.
Community Healthcare Association of New York State, a membership organization representing New York's 70-plus community health centers, focusing on providing quality health care and services to diverse communities across the state, regardless of immigration status, insurance coverage, or ability to pay. More information at chcanys.org.
So we're going to be live streaming right now. The number people can call, 888-858-9236. The number's on your screen, 888-858-9236. Questions are coming in. And let me just take a couple of these. Can the vaccine flare dormant health issues? If so, why?
That's a good question.
Yeah, it is.
Actually, the vaccine has been shown to actually reactivate some things like shingles. So it doesn't give you shingles. I think mostly what it does is because it stresses the body, and so it makes the body pivot what it normally does to make antibodies, it does have the ability to uncheck some other stuff. So things that have already been dormant in the body, like shingles, can flare up. So I have had, in all honesty, 2 patients where it has.
I do know of a woman who told me that she knew of people who got the vaccine and they never had anything else happen to them, and either somebody died or they got extremely sick, and for that reason she is not getting the vaccine. Yes. And she's not allowing her grandchild, who is under 10, to get the vaccine. What do you say to that person?
You know, I always say those home research projects of a subject of one person is so strong. Bad information and negativity spreads really, really quick, more so than positivity. You really have to look at more than just one person. I'm not God, so I can't say that you're not going to have a bad reaction or you're not going to die from a vaccine. But what I can say is that before a vaccine comes to market, it can't cause harm to people. If it was to cause death, it wouldn't come to the general population, you know, as quick. Many different things can happen. Some people can be allergic to particular vaccines and have an anaphylactic reaction, which their blood pressure starts to drop, they become unstable, and you really don't know what you're allergic to until you encounter it. But I caution people by making decisions off of one person.
That's good information. Right. Kenny, what are you doing in the barber shop? Are you getting with some of the other barbers in the city to try and help dispel myths and misinformation?
You know, we're planning on setting up a committee, you know, to actually educate a little more, you know, about this virus. We basically, you know, within the shop, like I said, we're taking a lot of safety precautions, just period. You know, you come in, we're still wearing masks basically. We cut hair with masks on, you know, we wear gloves, you know, just the little things, you know, and sometimes you get lax and, you know, you forget, but we're just trying our hardest to stay clean and keep everyone clean around us, you know. So, but
no, Dr. Ansari, I was just wondering, have you found that there needs to be, or there has been, we know, just a re-education of people when it comes to cleanliness?
Well, I always say that this disease has actually reinforced what our grandparents and our parents raised us: wash your hands, stay out of people's faces. Right. So those are the things that we were raised on, all of us. And that's what this disease does. That's one of the best ways to prevent the disease. Keep your hands washed, stay out of people's faces, and cover your mouth.
You're right. You're right. Nothing wrong with being clean. Dr. Davis, here's a question. Are vaccinated people the ones spreading COVID?
No. Here's the thing that I want to point out. The vaccine decreases severity of disease and hospitalizations and deaths. Transmissibility is something totally different. That means somebody's ability to pass it from this person to this person. So just because you're vaccinated, you could still potentially be a carrier and not know it. But the problem is you could pass it to somebody else who's not vaccinated. So one of the things that I try to be very clear on is that the level of antibodies needed to decrease transmission is totally different than what it is to decrease severity and hospitalizations and death. But most of what's spreading out there now is because of unvaccinated people. And keep in mind, like Dr. Ansari said, nature is nature. Viruses, it's survival of the fittest. Viruses are no different. They will continue to mutate, to continue to evade antibody responses. It's trying to survive too.
Mm-hmm. You know, that leads us to a question that Laura on Facebook asked, saying that all of this is very valuable information, so where do we go from here?
You get boosted. You call 716-986-9199 and press number 9 and you get your booster. But the truth is at some point you're gonna have to believe in something. So you gotta figure out what side you're gonna be on. And at this point, I don't go back and forth with patients. I don't go back and forth with people. If you don't want to get the vaccine, be very clear on 1, your reasons why, and 2, the next question I ask is, are you ready to be disconnected from the lifestyle that you're accustomed to? That's finances, that's resources, that's education. If you're gonna go in a bunker, to have at it. But most people don't want that. They want their cake and they want to eat it too. But you don't have the right to pass it on to somebody else because we're the ones that see them when you do. And it's awful to see.
Yeah. Benjamin in Toronto was wondering, is the booster really necessary? How effective is it? Because I think I can understand why he probably asked this question, because people who have been boosted get COVID and some of them have gotten sick, but not as sick as they probably would have gotten. So is it necessary?
It's absolutely necessary because once again, it decreases the severity of the disease. And you heard mine and Kenny's story when there was no vaccines out, right? I would love to be able to play Russian roulette now, because that's what people are playing, Russian roulette. Am I gonna get it really bad? Am I gonna go to the hospital or am I gonna have no symptoms? I would have loved to do that, but I didn't get that opportunity. It was 14 days of pure uncomfortableness. But the boosters are important because what we know is that, especially for Moderna and Pfizer, 5 months after your second shot, your antibodies start to dip down. Pfizer has reported 2 to 3% drop per month after that. Then your antibodies fall below the threshold, and then you're no longer protected. So you need that boost, that booster shot to boost that immunity back up.
Reverend Blue asked, should we continue masking or should we stop? And I know he's asking that because people are saying that, or what people are actually doing right now.
I'm going to continue to wear my mask. I know Dr. Ansari's going to continue to wear her mask.
And they're going to wear it in the barbershop, right?
They're going to wear it in the
service.
barbershop, right?
Definitely.
At some point, I get it. People are going to want to get rid of the mask. I get it. I don't think there's a wonderful number that says, hey, this is when you should, take it off. I think even when they drop it, some people, by personal choice, are still going to wear their mask, and that's okay.
Yeah, it really is. When we come back after going to Francesca, Kenny, I want to ask you what some of the Bills players had to say about this whole thing. You're watching the live stream of Friday Night Fight, Knockout COVID. I'm Claudine Ewing, and we are answering your questions about COVID and vaccines. Let's check in at our phone bank with Francesca Messiah.
Thank you, Claudine. I'm just going to start first with the phone number for your questions and to get the information. The phones are ringing off the hook. The number is 1-888-858-9236. 1-888-858-9236. I can't tell you how important this program is tonight. I can't tell you how important all these programs are about getting the vaccination. People are dying. People are dying. Or people are saying they can't come to something because they have COVID. They're trying to find out, where did they get COVID? Someone said the other day, I'm trying to find out from a tracer, where did I get COVID? I believe COVID, and I'll have to ask Dr. Davis, I believe it takes 20 seconds. 20 seconds. What does it take? 5 seconds to put your mask on? Put it around your ears? Make sure your nose is covered? This disease is serious. This disease is killing our community. This disease is killing our children. People are wondering why they can't go into buildings because they're not vaccinated. We have to, one thing this is teaching us, as our parents and grandparents taught us, and my mother always said, honey, did you wash your hands before you touched that? Honey, did you wash your hands before you gave me a kiss? Honey, I can hear that. Honey, did you wash your hands? Did you clean up? Clorox, hated the smell. I totally understand now. Clorox, those products kill germs. We don't want COVID to spread any further than it already has. Yes, it appears to be under control somewhat, But we have to get both vaccinations and the booster. We just heard our doctor say, talking about how the effectiveness, how it decreases every few months or so? But the whole idea is, let's get vaccinated. Please, let's get vaccinated. Thank you.
Francesca, thank you. That's great information. Kenny, as I mentioned to you, I know that some of your clients are Bills players, and I'm not asking you to tell me what player is sitting in the chair in your barber shop, but Bills Mafia is out there and they're watching. What were some of the players saying in the beginning?
In the beginning, everybody was nervous, A lot of, I'm not just talking about particularly the Bills, but a lot of players in the NFL, they opted out of that season last year, not this season, but last year. A lot of the guys were on the Bills. They were, we weren't coming out. I would go to their house, I would go to their place, and cut their hair. But it was kind of, they were nervous. A lot of guys were nervous about, they want to play the game, but at the same time they're risking their life. So it was kind of like a rock and a hard spot. They were in between.
Mm-hmm.
But most of the guys, they're vaccinated, and young guys working hard, So for the most part, everyone, that comes by the shop, they're vaccinated, and it's a big thing in that organization that everyone gets vaccinated.
Yeah. That's good information. I think people need to know that. Kids look up to these players as their heroes, and they want to know what they're doing about it.
And they're getting vaccinated. Yep.
Speaking of children, someone asked the question, how can you tell a young child has COVID when they can't express themselves like adults? This is coming from Joyce in Niagara Falls.
Oh, the babies.
Our babies.
I know. Kids, they have been presenting with a little bit more milder symptoms than the adults. Not to say that they can't get really sick also, because they can. They have been in Oshai's Children's Hospital, coming to Miller Fillmore Suburban Hospital, ECMC, so they're there. It's really hard, but we have home tests now. Mm-hmm. So I would have a low threshold. Those little things where they're snotty nose. I mean, I have a 6-year-old and an 8-year-old. Shout out to Leilani and Sanahe loves.
They're watching on Facebook.
I know,
too.
right? Yeah, right. The little one, she had a snotty nose for 2-3 days, and my husband and I, we were like, hey, we got this test from the school. We're going to go ahead and test her. So I mean, have a low threshold of testing because you just don't know.
And Dr. Ansari, because you deal with so many people in the community, has that been a concern about children? Do they have it? Should I test them? I don't want to put them through a test because they're so young.
Yes, my great nephew got it. He was only 4 months old.
Oh.
And what we had to watch for is his breathing, because he can't talk to you, right? Mm-hmm. So there, when you have babies that young, you have to watch how they're breathing because they can't tell you. So, and the other thing is, and going back to the mask thing, we're gonna have to get used to the new normal, because the winter's going to come again, and COVID is not going away. So we may have to wear masks seasonally. It might be a seasonal thing we do. It's just a new normal.
Life changes. Nothing stays the same in life. There's a question from Mark on YouTube. Mark, thank you. Has COVID been as severe as the Spanish flu in the early 1900s, based on research you all have done?
Has it been
severe?
Has COVID been as severe as the Spanish flu?
Yeah, I think the two things that they have in common is they wiped out a mass amount of people in a short amount of time. And the interesting thing about it is that both for Spanish flu and COVID, we didn't really do that great of a job in reporting, truthfully and honestly on it. How the whole notion of how the Spanish flu came about is it wasn't just in Spain, it was here too. Yeah. They just decided they were going to actually report on it and be transparent and clear about it. And there's a lot of similarities between the two.
One of the things I think this whole pandemic has taught us is that we just know a little bit more. We're paying more attention to our health, even terms, because I'm looking at this question from Buffalo. Someone called in. What is the difference between an RNA virus or DNA virus?
Look at that.
I know.
It took me as a second-year medical student to figure that out. So there's a thing called the central dogma of life, of all cellular level. It's DNA to RNA to protein. And that's the essential building blocks of everything. So these proteins build on each other to create cells, cells build on each other to create tissues, and so on and so on. So all that means is that if it's a DNA virus, it starts out here in that pathway. If it's an RNA virus, it starts out in the middle and it has to use somebody else's body to replicate to then turn back around. So for us, chemists and scientists, it's just another way of classifying and categorizing different diseases and viruses. But the truth is that the pathology in what's expressed is the same.
Mary Ellen in Gettsville called in and asked, if I had the COVID vaccine, why should I be concerned about being around unvaccinated people?
Because if you have not been boosted, those antibodies decrease 2 to 3% each month. And all it doesn't mean that you can't potentially get it. It's just going to decrease severity, hospitalizations, and death. And even if you have mild symptoms, those are still pretty uncomfortable.
So I know you're in the community, you deal with a lot of expectant moms. There is a question about should pregnant moms get the vaccine, but what are you hearing? What's the conversation like from families if they are trying to get pregnant or are pregnant?
Well, that's one of the first original myths, that if you take the vaccine, you'll be infertile. That was the first myth that we had to bust. Then and also for the men, they would be impotent if they got the vaccine. So that was some of the first myths. And so they are recommending that, and Dr. Davis can answer this better, that pregnant women do get the vaccine. There was a period at the beginning that the CDC said they shouldn't get it. Because we didn't know, there wasn't enough testing with women that were pregnant. So just like Dr. Davis said, there's a stringent process for us to be able to give, particularly that would be a special risk population. So that's why initially we didn't know what should they get, should pregnant women get the vaccine. So now that we have more studies, they're recommending it.
I'm loving that we're having good conversation and good questions. This is one from YouTube, Lisa on YouTube. So Dr. Davis, help us to understand whether or not this is true or not. She says, natural immunity is showing to be far superior than from a vaccine. Why are you still pushing vaccines or boosters for healthy individuals when Omicron is mild in the majority of the people?
So that's a good question. That study actually came out last week, a few days ago. So I hear this one a lot. Right?
Okay.
The natural immunity is there and it's better. So here's the thing. You can have antibodies. It's how effective the antibodies are at neutralizing or containing a condition. So just because you have a whole bunch of antibodies, we don't know yet, right? In this 5-year period, you're going to learn so much stuff that's going to come out because researchers are researching every little thing. People want answers right now. They want me to be able to give them the same answers I give them for pneumovax and flu. I can't do that because it took 7 years for them to make that. It was 7 years worth of research. You're getting this research that outcome happened on Monday. Okay, great. Now we got to figure out what to do with it. So I think we got to keep that in mind. But yes, just because you have a bunch of antibodies, it's how well are those antibodies neutralizing whatever that antigen is. That's the important part.
You all want to hear this. Dennis in Toronto called to say, thank you.
Aww.
Best overview I've ever seen, outstanding and simple.
Aww,
and I would agree with Dennis on that because I think we're all being informed, on this panel, I think Kenny and I are like the lay people. So it really is helpful. Cynthia in Buffalo wants to know, is this going to be an annual thing like the flu shot?
Probably. In all honesty, probably. I mean, because like I said, viruses, it's out now. You can't put it back in the bag. So until we find a better way of intervening and treating it, it most likely will either be every year or every 2 years.
The other thing is, to add to that, is that the variant in other parts of the world, you have to remember it's all over the world. So each country, each culture may have its own variant that we all travel. So when it changes, they actually will change the way the formulary is so that it can possibly meet the variant that that it has changed. So that's why the flu shot also changes every year, because it has different variants.
You know, before we go to the next question, Kenny, I just want to ask you, when you go into the shop tomorrow, because Saturday is usually a big day,
Yeah.
what are you going to tell them?
Put your gloves and mask on immediately. Immediately.
Yeah, because you know about it firsthand.
Right,
but
right.
don't you feel that being on this panel tonight, hearing from the doctors and just hearing the questions from people really...
It makes me feel better to talk to my clients and just let them know that this virus thing is definitely real and it's definitely mutating, like you said. And it's like you said, it's out the bag. It wants to live. So we got to counter it, you know. So
yeah,
right
we
now,
all want to live,
yeah,
right?
yeah.
Even if you were so much against the don't you want to live?
Yeah.
That's what I say.
Yes.
Don't you want to live? So then you need to think about that question.
Right.
That's how I look at it.
Yep.
Why are fully vaccinated people dying from COVID? Do masks reduce oxygen? That's from Jeanette.
Masks do not reduce oxygen to the bloodstream. I mean, keep in mind, masks are not new, at least in my profession. Surgeons, scrub techs, OR nurses, they wear masks all day long. They're still alive. So no, masks do not decrease oxygenation. Of course, in the summertime, and if you have COPD, yeah, it can make it a little more hard to breathe. My mother, love her to pieces, she's claustrophobic. It heightens her anxiety, right? So yes, you're gonna have these other real things, but the truth is biologically, no, it doesn't decrease oxygenation. Why are people who are vaccinated with COVID, why are they, still dying? I don't know. Why are we still talking about maternal mortality in Black women? I mean, I don't know. We're human, and we all have a time in which we're gonna die. But I will tell you that the numbers of people who are vaccinated who are dying is very small compared to those that are in our hospitals now because they're not vaccinated or they're not boosted, who are actually giving some of those nurses and doctors and my colleagues COVID who are vaccinated. I'm sure there's going to be something that will come out about viral load. I'm sure this has a lot to do with how frequent you come in contact with it, which is why we're seeing, my colleagues and healthcare workers just really dropping like flies.
Okay. You're watching the live stream of Friday Night Fight Knockout COVID. I'm Claudine Ewing. We are answering your questions with the doctors about COVID and vaccines. Let's check in on our phone bank with Francesca Messiah.
I just want to thank everybody for calling in. I want to thank our volunteers from the phone bank. I just want to say from the bottom of my heart what this has meant to me. And also, if you didn't have an opportunity to call in, I'm going to say this just from my heart, to stop by the Community Health Center of Buffalo, because I'm sure they'll have that information package, but I know they have information for you. They have information for you on COVID, getting the vaccine, getting the booster. You can even get the vaccine there. So again, I want to thank my friends and colleagues here at WNED PBS for making me and inviting me to be part of this evening. And I want to thank the community for taking time out of your evening to be with us. Thank you.
Francesca, thank you. Back to our panelists. Who are the trusted messengers and influencers in our community that the community can trust in to hopefully listen to and maybe sway opinions?
Well, one of the things that Dr. Davis and I have been doing a lot of is really educating the pastors, and one of my bosses is here who's actually in the movie, because they have a congregation of people that trust them. So when we educate them, they're able to educate a community. We're talking to sororities, we're talking to fraternities, we're talking to anybody that will listen, that will take the information and take it back to the community. So it's really trusted ambassadors. Those of us, the neighbor, the same way we get misinformation is the same way we can correct the information with our neighbors. So it's really having what we found for COVID, Dr. Davis and I, once the community got to trust that we're giving the right information, they seek us out.
Yeah. It's working. I mean, programs like this is what it's for. It's a Friday night, but people are still tuning in, listening in, and getting the information. Kenny, how do we teach people to be better advocates for their own health and well-being from your perspective and from your clientele? What works?
Just from experiencing it, you know, just educating them on the details of the virus and what we can do to prevent it, you know. Just staying clean, everything clean.
And there's another question I wanted to ask. The loss of life due to the COVID pandemic has been large, right? I think everybody here has lost someone or knows somebody who died of COVID. It has a lot of meaning for us. So what are the most important lessons that we can take from the pandemic and our response to it?
I would say for me as a physician, you know, tomorrow's not promised to you, right? The decisions you make today affect you tomorrow, and you can't buy your way into new health. It doesn't work that way. The first patient I lost was 37 years old. And on the flip side, you have to take care of your mental health. COVID fatigue is real. I mean, I know we talk about self-care and stuff like that, but I think what I learned through this pandemic is extending myself grace and mercy, and learning to practice that and do that every day.
You're right. Long-term COVID, that's being talked a lot about now, even more so as we get farther along. What is that?
So these are people whose symptoms don't resolve after 3 weeks or so. And some, it could be pretty severe for some, and it could be pretty vague. For myself, it took me about 3 or 4 months. Mine was just mental fog, taste and smell kind of going in and out, and fatigue. But I have some patients who have ended up with heart failure afterwards, shortness of breath, chest x-ray, CT scan, all that stuff is clear. I even have some people who couldn't walk, who had to get injections in their backs and in particular muscles. So it's a very wide range of particular things that can happen, but these are your people who don't resolve after about 3 weeks.
As we wrap this up, from each of you all, are we nearing an end? Are we better now than we were? Give people some hope.
I feel that we're better right now. People are getting more educated on this, you know. Like I said earlier, like when this first came to the city, everything was just stagnant. Everything was shut down. But we can see the volume actually picking up now. People getting more comfortable with each other, you know.
Is there hope, Dr. Davis?
Absolutely.
Yeah, it's hope.
I tend to be an optimistic person.
That's hope.
So absolutely,
Yeah.
Absolutely.
Because even with the numbers, but people need to know we can get through this.
Absolutely,
right.
Absolutely.
We already are through. We already
Right.
through, right?
Right.
And so it's an opportunity for us to really begin to once again care about each other.
Right.
And that's why we're having the vaccine, because we want to care and take care of one another.
Right.
So I think this is one of the COVID has actually helped to bring our humanity back.
This has been a great discussion. I hope you all enjoyed it as much as I did on a Friday night. Yes. Where it's snowing and raining and whatever else it's doing outside. So thank you all so much for being with us. Signature Cuts.
Thank you.
Dr. Ansari, Dr. Davis. It's a pleasure, because I think we all feel it, we know it, and it's our community that was hit hard and needed the education. Yeah. So even if we did this 3 months ago, we're doing it now because it still matters. Mm-hmm. It definitely matters. With that, we're going to bring this program to a close. We want to thank all of you for joining us on WNED, PBS, Facebook, and YouTube. My sincere thanks to the wonderful guests, as I mentioned, Dr. Ansari, Shakita Brooks-LaShore, and Marsha McWilson, Kenny Harris from Signature Cuts. We hope that tonight's program has really given you the information that you need to knock out COVID. That needs to be the phrase inside of the barbershop. On behalf of my co-host, Francesca Messiah, I'm Claudine Ewing. We want to tell you to be safe and have a good night.